Hi, I'm Deb Jerkois with NAMI New Hampshire. Thank you for joining me. We have been working on a series of transition topics, and tonight I'm going to be presenting transition topics, which is the mental health toolkits. I'm going to go ahead and share my slides with you, and we will get started with this presentation. Transition is a complex topic, and when we look at the age of majority, turning 18, there are tools and resources to provide guidance as you consider how mental illness may impact your loved ones at various times. I should mention all the images in this presentation are licensed or they're screen grabs from PDFs that we'll be sharing. All of the links will be available at the end of this presentation. And we have presented this previously to a live audience, and we did try to incorporate some of that feedback and answer those questions. We are trying to provide you some great resources tonight to help you on your journey as you navigate the wellness, the mental wellness of your loved one, and the tools that might be available to support you in that process and your loved one. So as I mentioned, I'm Deb Jerkois. I'm the New Hampshire Family Network Coordinator at NAMI New Hampshire. And in the children's department, my focus is to provide support, education, and advocacy for families supporting youth and children living with mental health challenges. What I bring to the role is my experience as a parent of individuals with disabilities and mental illness. And I must admit, I have had more than a few scheduled phone calls with the Parent Information Center over the years. So I was excited to work on this presentation because these tools are meaningful to me. This presentation is really meant to provide an overview of tools available and ideas on how to anticipate and navigate the age of majority. You'll hear bits and pieces of my own journey as a parent throughout this presentation. So thank you to the Parent Information Center for reaching out to NAMI New Hampshire about a presentation that focuses specifically on transition and mental illness. As I mentioned, this presentation will be going over tools and resources for you. And if you found us, you've either found this presentation on the Parent Information Center's website, PIC New Hampshire, or the NAMI New Hampshire website. And our goal tonight is to provide space for you to explore these different tools and understand a little bit more about what resources may be available. What we've really tried to do is create an organized manner to approach the age of majority and transition without making specific recommendations because all our loved ones are unique. We know this process can be hard, and we want to support you in the process. We have tools that we hope help you feel more prepared, and the ideas of questions or that you may want to ask within your own household. We hope these tools are successful, or you're successful in navigating these next steps with your loved one by utilizing them. This big feeling slide is really meant to say that we understand that this is a hard topic, and there are always options for support. It's always, for me, nice to mention the NAMI New Hampshire helpline that we have. It's staffed Monday through Friday, and generally you leave a message and they're super responsive. And now actually we are able to respond in Spanish as well. So that's new and official this year. So that's really exciting. But if you're in crisis, there's 988 or rapid response, which is 1-833-710-6477. We're here because mental health supports and access matter. This data that I'm sharing is from NAMI National, and it was compiled in February 2021. We know that high school students with depression are more than 2 times likely to drop out than their peers. And 56.6% in the Granite State, ages 12 to 17, did not receive care for their depression during the year of 2021. We also know that 7 in 10 youth in the juvenile justice system have a mental health condition. So what happens at age 18? Getting the information, the tools, and the support now can help navigate transition and the transition years. So the road ahead there, what is there? How are you going to get there? So I really like to break this into, where is the youth? Where are they going? How are they going to get there? And the big one is, how are they going to know when they get there? So there is the anticipated path. It's where youth travel. And there's those that travel a pretty direct route without so many bumps in the road, right? It's that anticipated path. It's complete high school, work, advanced education, maybe move out, career, family. And then there is the more interrupted path. So this could be affected by different factors, including mental health, disability, that could in fact impact the launch of an individual. And that interrupted path may have signs such as absenteeism, hospitalization, or even missed time for therapy and support. In my household, we have a term which is slow to launch. We're giving permission to our youth and to ourselves as parents. And that's a really important, giving permission to yourself as a parent to allow the timeline to be developed by the mental wellness of your youth. Age 18 may not mean diploma and on to the next thing. There are factors that contribute to extending time in school beyond age 18. And these factors could include some of the interrupted paths that I mentioned, or just academics in general. So there's lots of factors, but I think it's really important to just think about how to support along those steps. And there can be a moving target. And I'll talk a little bit about that in a minute once I fix my slides. Sorry about that. You're really getting like a live version tonight because there's just going to be little blips along the way. But what we are also going through tonight is an overview of tools and general information to help you getting started of the process and your planning. So from the mental health lens, let's take stock of how to incorporate the person in the planning of this process and consider how will their mental health impact them. And ideally, you'll be able to review this information over time so that you have a history to work from. Assessing, and evaluating over time gives you perspective and those little benchmarks, perhaps. And this can start today. You can learn together. Where are they? Are they in school? Or are they out of school? Where are they going? What is their path? Sharing so much positive input in this space is when you consider how they are going to get there from a person-centered focus, right? So discussing and defining how they're going to sustain and helping them know when they're going to get there, which is the space where they are thriving. There is thriving. Where are they? So they know at the age they can be in and out of school. We'll talk about each one of these steps. And, you know, there is a tool for this. And we're going to go through those tools. So let's break this down of how we'll organize the information. We'll explore the various steps and we'll include prevention planning. This is a process, and each step takes, well, as long as it takes. I say this because when I was working on guardianship and supported decision-making presentation, my co-presenter shared how she navigated a checklist and the tools were highlighting, and that in her situation, she found that there was almost like a give and take, like I'll get 3 questions answered, and then there's going to be like this amount of time that needs to happen as a break. And then there were other times where she said her youth was like, just give me the checklist. So it's working on how you are able to gather the information and what works for the youth and what works for you to help make the progress. But there's not a timeline. Again, it's really that opportunity to start with a few questions, see what works best, and really just consider the person first and the progression. It's really what's next to get there and the skill building. So this action plan timeline, we almost deleted from this presentation, to be honest, because at first we had lots of different age stages on this, and we thought that's really kind of putting pressure to a timeline. And so what we really came back to was intentionally starting this timeline, this process at age 12, 13, if you're able to. And then we left those other columns blank so that you really have the opportunity to look at the diversity of your person and that there could be an interrupted path. And so understanding things could happen in different order. But starting at 12 or 13 really helps to prepare for your child to be incorporated into the IEP process if an IEP is part of their plan, because an IEP starts at age 14. So these steps may be useful to help how your youth comes into this and advocates it as part of it. And then at age 18, the age of majority, it's a definitive date because things do change. And we hope that the tools will help you to prepare for this milestone around education, mental health, vocation, and healthcare. Nothing about us without us. This is about person-centered planning. By exploring what's important to the person, we can view the tools and supports that will be beneficial in setting them up for success. An example would be my daughter seeks independence attending her therapy session. Our plan is to continue working on all that is involved in her therapy, which includes understanding of diagnosis information, medication management. This could be viewed as a medical home. Medical home is really where all the knowledge and the information relevant to the person can be housed. And there's a portable treatment record I'll share tonight that's also a great tool to create this medical home. It's interesting because in our house, we have a new health insurance plan as of January 2025. And I emailed my daughter her new insurance card, and she had to print it out at the library and then submit the card when she checked in for therapy. We did a lot of planning for this process, and it might have taken a reminder or so, and an extra day or two, but she was successful. And how we defined success in this case was our objective was for her to bring her insurance card and check in and provide it to her provider. And she was able to do that, which is really exciting, especially for me, because it means that there's not going to hopefully be any billing problems because she had the right insurance at the right time. And that's a really good celebration in our household because we're able to celebrate her success of meeting that expectation. And it was a reasonable expectation to set for her. And it's just interesting because going through an insurance change, you definitely have different little bumps and things that you have to change in the road. So it's been really good for us to plan for that and just help her navigate that piece. So caring conversation, this is a worksheet that we have, and I will try to slide this over real quick so I can show you a little bit about what this caring conversation looks like. It's just going to take me a second because I pulled up a few too many things, I think, in preparation for this. So the caring conversation, I'm going to come back to this tool because it's a little bit tricky right now for me to pull that up. But what I want to say about the caring conversation is that I kind of modified this tool because what it didn't have in it is thriving. So when I looked at this, learn, share, discuss, define, plan, that's sort of how the sheet went. But I think thriving is a really important part of that because how are you going to know when you need support if you don't know what your base camp looks like? So in my experience, defining the thriving or periods of stability are important because that baseline helps me acknowledge and build awareness of my loved one's mental wellness. And this baseline is important because it helps me develop that safety net, how additional supports or a change in medication or recreation, any of those things may be necessary. We can't really understand the concerning times if we don't work collaboratively on what it looks like when the person is on the path to there, when they're doing well. And that was really one of the things from the last presentation is that someone said, I don't know what thriving is. And you don't have to have all the answers. But hopefully in the tools, as you work through the person-centered piece of these tools and really have a chance to check in with what makes your loved one happy, when they're being successful, when they're feeling good about themselves, I would use those as markers to understand when thriving is in place. And then we can talk a little bit more down the road of what it looks like when maybe it's not as maybe they're not feeling as successful. That thought of when it's more than a blue day, or what are their symptoms of mental illness. And I think we all probably, many of us have a list of what those might look like in their household. So where are they? This is where we really look at the youth self-assessment, and it's really looking at their future, their hopes, their fears, their strengths, obstacles. And you can really think of, the people that could help along the journey. And it's looking at education and working and living arrangements. How will they pay for their goals? That's a big one. What's available and accessible where you live? What about social life? What about Medicaid? What about medical and legal, excuse me. And the youth perspective checklist is a cool tool because it's really about the youth. So for the youth and really filled out by the youth. And I'm going to just slide this over. It's going to take me just a second. And I want to just try to make this a little bit bigger. So let me slide this. Bear with me as I move my screen. So this, as you go through this, right, those first questions of what your future looks like, and it might be a little intense for you to look at this, but then you could pick which questions, maybe one from each category, but thinking about that education piece. How will the classes you're taking now help you reach your goals? And this goes back to that thriving piece. How can you help them feel like, okay, these are things that make me feel good, or oh, this is stuff that makes me feel like I'm on my way to doing what I want to do next. How do you feel about attending college or vocational training? These are just really good examples of checking in with your loved one on these different areas and giving them the chance to think about it and knowing that it's a process. So doesn't have to be done like homework. It can be a longer process. And this is now I believe this is a 5-page document, so I don't have to go through all of it, but just the idea that it really does help you think about living arrangements. And, I do really like that the money piece is in here because I think that's a good reality check. And that goes back to, okay, so this is what your dreams are. Let's talk about the money piece of it as well. And also the what's available where you live, because for those of us in New Hampshire, public transportation isn't a given depending on where we are. And so there's lots of factors involved in it. And just thinking about agencies and other places that you can access and look at. So just wanted to pull that up to give you some ideas to think about what this youth self-assessment really looks like. And that will be included in the toolkit. What I'm doing is giving you a slide with the PDF link so that you're like, oh yeah, that's the youth self-assessment. So hopefully that makes it pretty user-friendly for you on the back end. So the other part of where are they is in addition to the youth perspective, it's what is the family caregiver assessment? So this checklist is similar, although what I really like about this one is that the strength-based checklist is just a really great tool. And I actually, instead of making you go through another Word document, I tried to pull the checklist out of the tool here. So I really love this because it's really thinking about what happens to support the individual in their journey. What a great place to explore from when you're able to focus on the strengths and then plan to utilize those strengths and overcome deficits in other areas. It can be very helpful to stop and evaluate when you see your child's strengths compared to see where they see their own strengths, right? So I gave the story about my daughter and the insurance card, and I see it as a strength for her that like she can go to the library and she can access the printer and she can do a lot of those things. But for her, that might make her feel anxious. And even that conversation is really important because thinking about her bandwidth as it applies to her next steps. And what I find in my own household is it's thinking about, not only the strengths, but also other trusted adults in their life too. There might be other adults that can help navigate some of these pieces, whether that's a direct service provider, whether that's a family friend, whether that's something counseling or otherwise. Just think about other ways that you can provide support for your youth. And what I was going to say is what I find in my own household is that this list, it provides me with ideas of topics that I may want to check in about. So one of the goals that comes to mind for me right now is my oldest has 2 classes remaining to earn her associate degree, which is really exciting. And I should mention that when my oldest was leaving high school in the fall of 2019, college wasn't even on her radar. COVID and the ability to attend classes online made college accessible. And as she's been able to attend some classes in person, her interests, her access, her priorities have shifted, and we've seen strengths emerge, and that's really excited. So I mentioned earlier that we use the phrase slow to launch in my household, and this really leads into the time and the opportunity to increase skills and confidence and answer the question, where are they going? but also taking some of that anxiety off the table. I mean, anxiety is something that we really live with. So helping navigate that balance of a timeline and what is realistic for my daughter in my case. So you've looked at what's important to the youth, and then your perspective as a parent caregiver is really also incorporating what's important for the youth. So I really like looking at this because it's a great way to organize the information. As a parent, you consider the hopes and the dreams of your youth, and then there's your perspective on this journey, which really matters because there's a balance. So, example, I always talk about the importance of mistakes and letting youth experience challenges in order to grow. My daughter, who I just spoke about, um, uh, has failed a college course. And then she took it again and she was successful. And that's a great conversation to happen because, you know, that saying, like, what's the worst that can happen? Well, she failed. Failing is one of those things people feel is the worst thing that can happen. And in our household, we have the saying, what happens next? So you can take it again, which is what she chose for a path. But timing matters too, and priorities in the overall plan. College is not for everyone. We're fortunate to have choices on this journey. There are individuals who walk away and don't take that class again, and there's nothing wrong with it. It's really looking at where they are in that point, what their strengths are. It might be hard to see a loved one walk away from a class or a commitment, and yet there is a mental health lens to use in viewing the situation. And this goes back to a few slides where we're talking about thriving as well as when there needs to be a plan for support. So housing is a really interesting piece. So also on the theme of where are they going? So in my household, I have an adult who actively discusses an apartment and independence. And although they're not there yet, it's very powerful to see them visualizing their next steps. Knowing what they want is important to help with how are they going to get there. Important too, that's what she wants. And important for is how we can plan to support this intention of living, in her case, outside the family home. There are options. So, moving out doesn't have to be living on your own. There's lots of steps along the way. But just like the early example of with medical management and coordinating insurance with her therapist, we also look at the pieces that are important for her to be able to move out. Exploring the ways she can live on her own and money management are important for her. And being aware of thriving and also times where support may need to be increased. So just thinking about these pieces. And I realize there's quite a few checklists and tools along the way. And part of it is to really acknowledge that everyone's journey is unique. And you may choose bits and pieces of these tools along the way and come back to this at different times based on where the youth that you're looking that you're concerned excuse me, the youth you're concerned about where they are in their journey. Where are they going? So another important piece of this is what brings them joy, building a full and enriched life. Part of this as a parent and a caregiver, it may include the mental health lens that checks and balances system. What are the signs of mental illness for your loved one? Sleeping too much, lack of energy, not wanting to get out of bed, and avoidance. And as a family that has experience with bipolar disorder, is the energy too high, the sleep minimal, and the focus intense? We're all unique. And so the more we pay attention during the periods of mental wellness and also mental illness, the more we're able to be aware of it and additional supports that may be necessary. And again, defining what's thriving, but then also defining when there needs to be some additional support. And, thinking about this growth, this helps, defining these helps to support them in their journey of knowing when they may be ready for that next step, that big step of moving out, which is not happening yet in my household, but it is on the horizon, and that's exciting for them. So prevention planning is just such an important piece to also talk about. In school, I think about fire emergency. We learn stop, drop, and roll, stay low, set up a meeting spot. Let's break down the stigma around mental health, right? Emergencies, crises, events, these things we should make a plan for them. Now that you've been working on youth and caregiver perspective, you may be ready to ask the question, how do we work together to plan to know what thriving looks like, and also to look what looks like when additional supports may be necessary to help prevent a mental health crisis. And there is a tool to support this discussion and independence. So just thinking about what might be helpful for your youth, and just guiding this conversation. So I'm going to actually slide this one over really quick again. Bear with me. And I'm going to want to make this a little bigger, I think, because I'm not sure if this is going to show up as big as you want it. Let's see. Let me just adjust a little. I might have gone a little too far. Bear with me as I adjust it. So defining what prevention planning is. So this is just walking you through ideas of the behaviors and clarifying consequences, thinking about all of these pieces. And I think I briefly mentioned before that in addition to the youth and your family, are there other individuals, adults, and even peers that you can decide are you can define with your youth that may be helpful in a time? So this just really walks you through it, and I think this is a great tool because in the moment it's really hard to remember some of these pieces, and so to have something to look at is incredibly helpful. I know for me, I know I gave this example. We had someone and they're fine, but we did have an accident occur on our front lawn, and it knocked out our power and it blew our power off our house, and it was a big event. And I remember being outside and my neighbor came over, and I couldn't remember the electrician's name or number or anything. Like I have my cell phone, I'm looking at it, it's just not registering because in the moment when you're feeling anxious, it's really hard to pull those details out. And so prevention planning is just really helpful to have some things written down. And we're going to talk a little bit more about that as well. So there is a checklist for the transition process in general. And I waited a little bit to pull this one out. Some people may choose to start it, but this starts with ages. This has ages in it. And I think that the benefit of creating these tools and customizing them for yourself is not thinking so much about the age, but thinking about the stage of where the loved one is. So you might be saying by now, like, oh my goodness, not another checklist. But when I send out the slides, I'm including the pages that I speak about them. So you have a reference to help click through them. And ideally, you're going to approach this whole process in bits and pieces. And um, I might have more checklists and tools than you need, but again, it is a personal journey. So I don't want to assume that the tools that work for me are the exact tools that you'll need. And you might even choose to refer to this one at the beginning because it does have ages and stages if you want that. So, however, I just think it's important to help worry less about the age that something happens and more about the priorities of setting up your loved one for success and safety. So we gather this information from parent and youth, and then we look at this checklist to make a plan of action. So we talked about prevention, so it should also make sure that I talk about that, there is support for navigating a crisis. We're trying to do the work here to help prevent a crisis, and yet at times they happen. And NAMI National has a resource guide, so that information is available when you need it. It's much harder to go looking for it when in crisis, like I was just saying. So plan ahead, and we hope this tool is also useful for you as well. So this link is also available. Okay, so portable treatment record. I mentioned this earlier when I talked a little bit about medical home, and I'm going to also pull this one over so we can just look at this one together as well. So just bear with me while I slide this one over. Sometimes it's nice and works well to use two screens, and sometimes it does not. But so far, I think we're doing okay. I wanted to zoom in, so this is something you're able to see. So the top of the portable treatment record is pretty standard: name and emergency contacts and pharmacy and primary care physician. But as you go through this, psychiatrist, pieces like that, and I'm going to go down a little. I'm just trying to not go too fast because I don't want to give anyone motion sickness. Or maybe that's just for my own benefit. This medical history is a really important piece because I spoke earlier about my daughter wanting to have independence, especially like in her medical piece, right? So medication, reaction, all of those pieces, again, when you're in that moment, having that information written down so you don't have to remember like, oh, which medicine was making her tired, or which medicine, was causing tardive dyskinesia, like, rapid eye movements or shaking, or, involuntary physical movements. Like what were the reactions? And this helps you just have everything documented so that you can work on that ownership and that shared conversation of what works for your loved one. So allergies, reactions, um, major medical illnesses, any procedures, and then diagnosis stuff. And that's an important piece too, because helping understand the diagnosis and helping that ownership. And, again, it goes back to stigma, right? Like, let's take the stigma out of this. This is a tougher one for some of us to fill out that have to fill this out, but it happens. And we learn, hopefully from these, we learn. And one of the things, I know in my household we can celebrate is it's been a while since we had one of these dates of admission. So it can be a tool and it can help with the discussion. So I won't go through all of this, but I did just want to preview this with the idea of medical home, just really gathering all that information in one spot, which is just really helpful from a safety standpoint, but also just as you're on this journey to help your loved one navigate and have a better self-management of everything. So, and it's interesting because, well, I'll talk about releases in a minute, but, you know, it's hard to get this information shared after age 18. And so filling it out together and filling it out proactive is important. And, there is the release part, which we will talk about. But so we've been talking about where are they? Where are they going? What's the plan? When I say where they're going, I don't mean physically. I mean, I would love right now to be in someplace warm and sunny, but this is about where are they going in regard to their hopes and their dreams. So what's the plan so you can help them on their journey? And self-awareness and ownership of their medical information, their communication, their medical team, and where you fit in as a caregiver, as a parent or caregiver. The medical home, that's your portable treatment record. So it is in the detail. And thinking about things like, will providers accept patients aged 18 and older? Who are your family doctor and dentist? Do you have any special doctors? Thinking about psychologists, psychiatrists, therapists. And, I mentioned keeping track, and there's other pieces to keep track of as well, like dentists and specialists and things like that. So um, going back to the medical home, it really supports you in what is the plan. And anticipating like the healthcare collaboration too, right? So um, one of the things is I wanted to mention that the Parent Information Center and New Hampshire Family Voices, they have additional healthcare transition resources, especially if you're exploring things like options like medical proxy and things like that. What we're trying to do tonight is really focus on this mental health toolkit piece. So we're providing you with the lists and connections that help you in how you want to plan. And one of the tools we can make sure that we share at the end of this is the Parent Information Center of New Hampshire, their healthcare transition link on their site. Because thinking about all of the different components involved and what your resources are, school and area agency, the behavioral mental health centers, medical providers, the Parent Information Center, New Hampshire Family Voices, and of course, NAMI New Hampshire. So you saw FERPA and HIPAA, and I didn't talk about them before, but I do think it's important to just make sure that I provide a very brief overview about how they differ and when they apply. So FERPA, Family Education Rights and Privacy Act. So young adults, as of age 18, control access to their own information. So it's basically about the education piece of things. HIPAA, Health Insurance Portability and Accountability Act, it keeps medical records secure. There is some crossover where medical professionals work in a school setting, because that's when HIPAA would apply in a school setting. But you can research these a little bit more on your own. But I think what's important to say is failure to comply with either does result in fines, penalties, or revocation of funding. And so it's important, and it is protecting rights. And so it's helpful to know these pieces. But since I'm not here to advise, I'm just going to give that general overview. The other thing I just wanted to also, since we spoke about the FERPA and HIPAA, I thought it might be helpful to just bring in the slide about the about age 18, the age of majority. So just thinking about a few things that marriage, entering a contract, taking out student loans, those are all things that an 18-year-old has a say in. So it just changes things, and you're going to want to think about anticipating those things. And it goes back to the communication piece of having those conversations with your loved one to think about where they may want your supports, what might be helpful for them. So releases, I also did mention this really quickly. Releases are part of the communication plan and your loved one with your loved one and medical providers. So I'm just grabbing this, I'm including this screen grab, which is a little blurry, and I apologize, but the idea is that these authorization forms, they do exist. And if you are looking to have that ability to connect with medical providers specifically, then you can look at using a release like this. And that's something that you can have as a conversation with your loved one. It's interesting because my husband and I were recently pulling out dental information for paperwork, and we all had to do one of these forms. And I was just thinking how timely it was as I worked on this presentation, because everyone in my household is over 18. And so there was lots of paperwork to sign. And it reminded me that even if you might have taken care of this in the medical side of things, that there is the dental piece and there are other areas. So just remembering those. And I'm also familiar with this form because as part of the guardianship process, if you were to choose that path, this is one of the pieces of paperwork that also does have to be completed. So a few transition tips that might be helpful. So medical transition, it's really more than transferring care, because you're looking at when the youth becomes an adult, how they learn about their mental health condition or learn more about it, that increased understanding of how to care for themselves, and then also understanding where extra assistance may be needed. And we know early planning, right? Early planning is always beneficial. And the healthcare transition process begins at age 12. And as I mentioned on that arrow slide, the IEP, their involvement in the IEP begins at age 14. So we really want to help you determine how much responsibility your youth will be able to manage at 18. When I say we want to give you the tools with the mental health checklist to explore that. How much will they be ready for? And then other important questions to answer. Is there a process available for youth with mental health care needs to facilitate the transition to adult medicine, right? So discuss medical transition and thinking about the age when your doctor stops seeing adults in their pediatric practices, excuse me. Some primary physicians now actually, or family physicians, are combined. So there could be options. So ask those questions, because you're maybe you're already in a place that will continue to provide services, but you won't know if you don't ask. And think about who coordinates the process and how does your youth become included in it. So you as a parent, these tools will help you to guide that process, but there may be other professionals, whether school or counseling or other trusted family friends that have experience in this, that might help you along this journey. And who might make recommendations. So the clinic, we've talked about the specialists and how the transition to adult care. And, also the stability too, right? So is it a hard and fast rule? So maybe your pediatrician does try to transition youth at age 18, and yet maybe if there are extenuating circumstances, there's some time for that process. So just knowing what the expectations are, and really kind of starting with who do you want to transition first. And I think there's some providers that we all try to hold on to a little extra long. So a lot of respect for that. This is not active now, but when we presented this, we did ask, when I think about mental health and transition, I'm most concerned about, and what we heard was being able to manage meds. Another one was my kids accepting treatment when I'm not managing. Safety, the word safety. Another one was my child being open and an honest member of the process. So, hopefully we're going to give you some tools to help you navigate some of these pieces. So we've talked about where are they going, how are they going to get there? And this is that person-centered planning piece. So it's the mental health literacy and like why do we need it? Well, it's really thinking about the recognition piece first. So recognizing mental health problems as symptoms. And then the knowledge, right? Where and how to seek that information and attitudes, right? Let's reduce stigma around mental health conditions to promote recovery and resilience and strengthen overall wellness. We understand that mental health challenges can and they should be treated. So this is another question that we had about how will we know when they get there? What does thriving look like? And so I'm hoping that by taking feedback from the last presentation, we've been able to talk a little bit more about the tools that you can use to help define thriving and have a better base camp. I mean, I think about this as you'll be able to really develop an understanding of thriving or mental wellness, which is kind of like a base camp for this journey, right? This is where things are good. We're not quite ready to summit, but so developing a mental health toolkit. And this is that person-centered piece. And a lot of what we've been talking tonight about defining the thriving when a safety net is needed, and then those authorizations and the communication plan. Communication plan is really important because that could be as a parent where you can ebb and flow. So you might have a release, but not need to use a release. But maybe that release is there so that you can communicate at a time that might be beneficial for your loved one. And documentation, that medical home, the providers, the medications, the resources, the history, and also what's next? What happens after crisis? How do we start that rebuilding process and move forward? The more that you can create this tool and it can continue to grow, and that's the beauty. I mean, I happen to be someone who likes to type everything. So this document can just keep evolving or save as, start a new one and move on. So lots of ways to look at it. One of the things I wanted to share tonight was we've talked about these toolkits and hopefully we've given you a lot of really great resources. And I wanted to talk about some of the things that NAMI New Hampshire is doing. And so one of the programs that NAMI New Hampshire works on as part of one of many agencies that's part of the Children's System of Care, we collaborate, we come together on this annual event, which we're coming into the 7th annual year, of Magnify Voices Expressive Art Contest. And what this contest is about is providing a way for the youth of our state, grades 5 through 12, to express their own or peers' journey with their mental health. And so the picture that I'm showing is at the Suicide Prevention Week press conference. And the young woman in the middle, Abby, was there and spoke and shared both her art from Magnify Voices, but also her story as part of this announcement, this proclamation. And it was just really incredible because we want to hear from our youth. And so this year, when we were announcing the contest, which we just announced January 2025, we reached out to a former Magnify Voices participant, and she created this amazing video for us. So I'm going to go ahead and share a video in a video. So let's hope this works out. This is quick. It's like 2 minutes, so please bear with me.
Hi everyone, my name is Erin Murphy and I'm from Windham, New Hampshire. In 2021, my cousin Amy Murphy and I submitted our video, Dear Younger Me, to the Magnify Voices Expressive Arts Contest. To our surprise, our video ended up winning the People's Choice Award and the Excellence in Production Award. Since then, I've worked with NAMI and Magnify Voices to advocate for change in our mental health system, as well as the way we communicate about mental illness with the goal of eradicating the stigma that surrounds it. Now, I'm excited to share that as of Monday, January 6th, the 7th annual Magnify Voices Expressive Arts Contest is officially open for submissions. This contest is all about recognizing and celebrating the creativity of youth. Students in grades 5 through 12 are invited to submit artwork that reflects their own experiences or the experiences they've observed in their peers related to mental health challenges. As we all know, mental health is unique in that it is often invisible. Those who haven't experienced similar struggles might not fully understand what it is like to live with mental illness. That's where Magnify Voices comes in. It's an incredible opportunity to give a visual representation to what's often unseen, and to help others better understand what a day in your life might look like. This was the biggest impact I saw from the video my cousin and I created. After winning, our video was shown all around New Hampshire, at colleges during orientation, in suicide prevention trainings for teachers and school staff, and even to families who had lost loved ones to suicide. It even served as a lifeline for individuals struggling with their own mental health, helping them get through the difficult times. These experiences highlighted an important truth: we're not alone in our struggles. All of these opportunities to connect with others were made possible through my participation in Magnify Voices, and I urge every single one of you to take part. You can submit any type of artwork you wish, from poems to short stories to songs, videos, paintings, or anything that helps you express your emotions. If it is meaningful to you, it's worth sharing. Personally, one of the most memorable days of my life was the celebration event, where we got to see everybody's submissions from that year. This year, the celebration will be held on Wednesday, May 21st, and the location will be announced in April. For those who choose to participate in the judging process, there's a $250 cash prize up for grabs, and your artwork may even be featured in a planner. To learn more and submit your artwork, please visit nhcsoc.org. Bye!
Thank you. Hopefully you stuck with me on that. I could spend a lot of time on Magnify
Music.
Voices. Oops, excuse me. But I do want to just cover a few more resources before we sign off. And so another one I wanted to mention, which is really incredible, is the New Hampshire Family Voices Lending Library. If you haven't had a chance to experience this, it is a resource where you can go online, search their catalog, and you're able to request books. And when they're available, they'll send them to you with a postage paid envelope to send back. And I can say from personal experience what an incredible benefit this has been, especially when my children were younger, when it was hard sometimes to access public areas. And so a great resource to check out. And then NAMI New Hampshire has suicide prevention training, which I think Erin mentioned briefly in the Magnify Voices video, where we go into schools and we create a safe space to talk about suicide response. And it is just unbelievable how empowered this youth become, but also knowing that they're not alone, and when they may want us to choose 911 or 988, what resource is best to help connect for themselves or for a peer. And this was featured recently on WMUR, where Abby Porter, a Salem High School student, shared her story about struggling with mental health and how being part of Connect Youth Leader really changed her life. And so it's exciting to think about some of the programs that we have in the schools that are really helping our youth. Another one that's amazing is Ending the Silence. And this is a program that NAMI National started, and now we're able to offer this in New Hampshire, and we have 3 different versions of it. So Ending the Silence for students, we have it for staff, and then we also have it for families as well. And those are happening throughout the state. Life Under Construction is on all the socials, and this is really for youth. It's age under 26, and then we have a young adult who moderates it. And this is, really trying to create a space where youth can connect, and we push in resources around youth and empowerment, thinking about whether it's a scholarship or some event that might be beneficial for them to attend and help them on their journey. So Hope Starts With You. NAMI New Hampshire now gives more than 50,000 Granite Staters help and hope for those affected by mental illness and suicide each year. And in 2019, that number was 21,000, and now it's at 50,000. We continue to be there to support, and we thank you for attending tonight as well. I wanted to just also mention again the NAMI New Hampshire information and resource line. This is really the gateway to NAMI New Hampshire. They can answer a lot of questions about the services that we provide. And then these are the resource links, which are part of what you will receive at the end of this. And so I am going to stop sharing now. That concludes our presentation. I really thank you for joining us. And my name is Deb Jerkois. I'm the New Hampshire Family Network Coordinator with NAMI New Hampshire. And thanks so much. And I will take care. I hope you enjoyed the resources.